Hi all. Today we'll discuss how to take a family history, a key part of understanding a patient's overall health risk and potential genetic or environmental influences. Start by asking open-ended questions, such as, are there any illnesses that run in your family? This broad question allows the patient to share relevant information freely. Avoid limiting the discussion to the specific condition the patient has presented with. For instance, instead of asking only about heart disease in a patient with chest pain, begin more generally, and then move to targeted questions like, have any of your family members had heart trouble or needed treatment for heart disease? While single-gene inherited diseases are relatively uncommon, they are important to recognize. Conditions such as cystic fibrosis often arise in families where both parents are unaffected carriers, but may have affected children or siblings. In most clinical practice, however, the significance of family history lies in multifactorial and polygenic conditions, diseases influenced by both genetics and environment. For example, having a relative with autoimmune disease can increase a patient's likelihood of developing another autoimmune condition, even if it's not the same one. Similarly, illnesses like asthma or atherosclerotic cardiovascular disease are so common in the population that their presence in family members might not strongly alter an individual's risk, but still provides useful background information. When documenting, always focus on first-degree relatives, parents, siblings, and children, as they share the greatest genetic link. Ask whether these relatives are alive or deceased, and if deceased, at what age and from what cause. This can provide clues about hereditary or lifestyle-related risks. If you suspect a hereditary disorder such as hemophilia or Huntington's disease, it's helpful to construct a pedigree chart to visualize inheritance patterns. Make sure to note any adopted individuals to avoid confusion about biological links. Beyond genetics, remember that family history can also reflect shared environment and lifestyle factors. Ask about the health of other household members, especially in cases involving infectious disease or exposure to environmental risks such as smoking, damp housing, or occupational hazards. To summarize, a good family history combines open questioning, targeted follow-up, and careful documentation. It helps identify genetic risks, shared environmental influences, and conditions that might guide screening, prevention, and patient education. Taking the time to understand a patient's family background not only sharpens your diagnostic insight, but also deepens your holistic understanding of their health. Thank you.